Come in.
All right, I'm just washing my hands. Hi, my name's Angela. I'm going to be your nurse for the day. How are you doing?
I'm doing good. How are you?
Good. So today we're going to be doing a nose, mouth, and throat assessment. Is that okay with you?
Yes.
Okay, so a couple questions before we start. Do you frequently get colds or flus?
No.
Okay, and then do you have any problems with your teeth or your mouth at all?
No.
Okay, so we're going to start by inspecting his nose. So what I'm looking for is symmetry. So I see that your nose is right in the middle, midline of your face. I'm also looking for any abnormalities, inflammation, or lesions. And so I don't see any. Can you tilt your head up a little? So I'm also looking at his septum. It is also in the midline. And then his nares are equal in size. So I'm also gonna, is it okay if I touch your nose?
Yeah.
So I'm also gonna palpate, so tell me if there's any pain or tenderness.
No.
Okay. And so I'm also going to palpate his sinuses. So first I'm gonna palpate his maxillary sinuses and then his frontal sinuses. Was there any pain there?
No.
Okay. So next we're gonna be testing his nasal patency. So I'm gonna have you cover one nostril and breathe in and out. Okay, and then the other one. Okay, so they're both clear, so his nostrils are both patent. So next we're going to be looking at his mouth. So I'm looking at his lips, and they are pink, moist, and I don't see any cracks or lesions. Would you mind just showing me your teeth? Okay. So his teeth are straight and even, no signs of disease, no missing teeth, and no misplaced teeth as well. And then can I see one more time? Okay, so his gums are tight around his teeth, which is normal. There's no signs of any gum disease, so there's no bleeding, discoloration, lesions, anything like that. Would you mind opening your mouth? So first I'm checking the dorsal surface of his tongue, which is pink and rugged. And then would you mind lifting up your tongue? Okay. So his ventral surface of his tongue, which is the bottom, is shiny, pink, and it has veins. And then just one more time with that. So I can look at the bottom of his mouth, or the floor of his mouth, which is a very common site for mouth cancer. And so I don't see any concerns with that. There's no lesions, no cuts, nothing abnormal there. And so I don't actually have a tongue depressor, but I would next use one to look at his buccal mucosa, but I'm just going to do the best I can with my pen light. So that's the sides of his mouth. And they're both shiny, pink, and moist. And so next I would be looking at the roof of his mouth and looking at both the hard palate and the soft palate. Okay. So the hard palate is a bit white and rugged, and then the soft palate is soft, pink, moist. And then next I'll be looking at his uvula and tonsils. Here, can you stick your tongue out a bit? And once again, I would use my tongue depressor for this part as well. But from what I can see, his uvula is in the midline of the back of his throat, and his tonsils are pink, moist, and they have some deep crypts, which is normal as well. So would you mind sticking out your tongue and saying ah?
Ah.
Okay, so when he says ah, his uvula and his soft palate both go up. And so that's his cranial nerves number 9 and 10, which are the glossopharyngeal nerve and the vagus nerve. And then last, if you don't mind, I'm going to have you stick out your tongue. Okay, and his tongue is in the midline of his face when he sticks it out, and that is also cranial nerve number 12. So thank you so much. That was our nose, mouth, and throat assessment.
You're welcome.